Allopathic medication, part 17. Level C. At least fair scientific evidence suggests that the clinical service provides benefits, but the balance between benefits and risk is too close for general recommendations. Clinicians need not offer it unless individual considerations apply. Level D. At least fair scientific evidence suggests that the risks of the clinical service outweighs potential benefits. Clinicians should not routinely offer the service to the asymptomatic patients. Level 1. Scientific evidence is lacking of poor quality or conflicting such that the risk versus benefit balance cannot be assessed. Clinicians should help patients understand the uncertainty surrounding the clinical service. Great guideline panelists may make strong or weak recommendations on the basis of further criteria. Some of the important criteria are the balance between the desirable and undesirable effects, not considering cost, the quality of the evidence, values, preferences, cost, resources, and utilization. Despite the differences between systems, the purpose the purposes are the same to guide the users of clinical research information on which studies are likely to be most valid. However, the individual studies still require careful critical appraisal. Statistical measures. Evidence based medicine attempts to express clinical benefits for tests and treatments using mathematical methods. Tools used by the practitioners of evidence based medicines include likelihood ratio. The pretest odds of a particular diagnosis multiplied by the likelihood ratio determines the post test odds. Odds can be calculated from and then converted the more familiar probability. This reflects Bayes' theorem, the differences in the likelihood ratio between the clinical tests that can be used to prioritize clinical tests according to their usefulness in a given clinical situation. AUC ROC. The area under the receiver operating characteristics AUC curve ROC reflect the relationship between sensitivity and specificity. For a given test, high quality test will have an AUC ROC approaching it 1, and high quality publication about clinical tests will provide information about AUC ROC. Cutoff values from positive and negative tests can influence specificity and the sensitivity, but they do not affect the AUC ROC. Number needed to treat NNT, number needed to harm NNH. NNT and NNH are the ways of expressing the effectiveness and safety, respectively, of interventions in a way that is clinically meaningful. NNT is the number of the people who need to be treated in order to achieve the desired outcome, for example, survival from cancer in one patient. For example, if a treatment increases the chances of survival by 5%, then 20 people need to be treated in order for one additional patient to survive because of the treatment. The concept can also be applied to the diagnosis test. The diagnostic test, for example, if 1,339 women aged 50 to 59 need to be invited for breast cancer screening over a 10-year period in order to prevent one woman from dying of breast cancer. Then NNT for being invited to breast cancer screening is 1,339.